Hello everyone, my name is Dr. Anganai. I am a medical practitioner practicing in Victoria Falls, Zimbabwe. And we are going to have a short talk on the microvascular complications of diabetes. As we all know, diabetes is a disease in which the body struggles in handling blood sugar levels. The resultant effect is elevated blood sugar levels that then damages your organs. So the two main common types of diabetes that we know are type 1 and type 2. With type 1, where you have the body not producing enough insulin to handle blood sugar. Insulin is produced by the pancreas, is the hormone that helps in bodybuilding. It also helps in regulation of sugar levels in the blood following a meal. So in type 1, those insulin producing cells are lost either due to immune destruction process or probably due to some unknown mechanism. And then in type 2 diabetes, you have the cells producing insulin, but it's being resisted where it acts. So insulin acts in the muscles, acts in the liver, but in those what we call target organs where insulin acts, it's resisted, so it's usually called insulin resistance. There are other rare forms of diabetes that I'm not going to discuss today, but those are the main two types, and both types end up needing insulin, and both types can result in the microvascular complications that we're talking about. So the three common microvascular complications that people with diabetes face: retinopathy, which is the disease of the eyes; nephropathy, the disease of the kidney; and neuropathy, which is the disease of the nerves. So in terms of diabetic retinopathy, we are saying in patients with diabetes, the elevated blood sugar results in certain changes in the blood vessels that supply blood, nutrients, and oxygen to the retina, which is the visual apparatus of the eye. And when that retina is affected, a lot of things can happen. Because the blood is not flowing correctly in diabetes, you can have a patient developing new blood vessels. They can also have cataracts, is when they have whitening of an eye. When you look from examination, when you're looking at directly the brown spot in between there, you can see whitening. That will be a cataract that is being formed. So the formation of new blood vessels that can happen as a process of diabetes in the retina can actually lead to bleeding inside the eye. The retina can get dislodged from its place, and then a patient can end up being blind. There are available therapies. If you visit your doctor, they may prescribe some injections inside the eye that targets the new blood vessels, or they can use laser therapy to try and stop the blood vessels from forming. The second microvascular complications is nephropathy, is when you're talking of the damage that can happen to the kidney. So before your kidney starts showing symptoms of damage, the first thing that is seen is leakage of some proteins that are normally not leaked in the blood, like albumin. So when there is leakage of that protein, you know that the kidney's function is compromised, and your doctor may request that test for it to be done so that you can be told, or you can actually be told that your kidney is at risk of ongoing progressive damage, and your doctor can prescribe medications such as losartan, that are called angiotensin receptor blockers or angiotensin converting enzyme inhibitors. In our setting, we talk of enalapril. Those are medications that can be given if there is issues in your kidney. So that the test that happens is that you test how much protein is being released by your kidney. We talk of the albumin to creatine ratio. So in their testing, there's creatine in a substance that is released by your muscle and then eliminated by the kidney at a constant rate. Then comes the albumin, which is the protein that's supposed to be in your blood that is not normally eliminated. So when you look at those things, the ratio thereof can tell you if your kidneys are complaining or not. And if your kidneys are complaining, with normal talk of that ratio is above 30, and when it's above 300, you are really, really concerned that your kidneys are really going to get into some serious problem is if they are not attended. So part of preventing that involves giving you the medication that I mentioned, and also maintaining a strict control of your blood glucose to target what is known as the HbA1c to less than 7. HbA1c is a measure of your average blood sugar for 3 months, and if your HbA1c is above 7, we are saying that your diabetes is poorly controlled, you're at risk of getting all these complications. At the same time, control of the blood pressure becomes also very important. You want your blood pressure to be below 130 for the top part, which is called the systolic blood pressure, and below 80 for the low part, that is called the diastolic blood pressure. We also wish to make sure that the lipids, the fat levels in the blood are also well controlled. We target that your cholesterol, your fatty issues, everything should be at least within normal levels. If you are smoking, taking alcohol, that should be stopped. And all these contribute to reducing your risks of advancing to kidney disease that require dialysis, and also to a worsening of the earlier complication that I mentioned that is called retinopathy. The last complication that I'm going to deal with is neuropathy. So neuropathy is the disease of the nerves. The nerves are you can say these are the electrical wires that connect your brain and spinal cord to your body organs. So we are saying that if you have if you step on a nail, for example, the nerves conduct that pain and sense signal of the brain and tell you that you've stepped on a nail and that nail is painful, you need to step off your feet. But in patients with diabetes neuropathy, they do not feel those small injuries happening to them, or they may feel pain that is usually exaggerated, or they may actually feel pain when you do something to them that is not painful. So we are saying when there is diabetic neuropathy, it needs to be managed by controlling the pain, by also doing regular foot care. We say you should have your feet assessed by a doctor every year, just like I want your kidneys evaluated every year, and also your eyes evaluated every year for these complications. We also are saying that the assessment should assess pain, temperature, sensation. It should also assess if you can sense your position in space, to say, can you feel balance? Can you see that you are seated, standing? Can you sense vibration using a tuning fork? So when there is problem, therapy needs to be initiated. And if this diabetic neuropathy is not attended, there is a risk for deformities in the joints of the foot. There's risk for formation of wounds or ulcers, for infections, and also for amputation. That's also when your limb is removed, both probably dead because of blood vessel disease and also because the nerves are also affected. Occasionally, because the nerves are affected, some of the nerves that help regulation of blood pressure, respiratory rate, the pulse rate, they may also become affected, leading to issues of dizziness, low blood pressure, sometimes a high heart rate whilst you are just resting, you're not exercising. So all these needs to be managed and to be. So in regards to these microvascular complications, They can all get worse if not attended to. For retinopathy, can progress to blindness. For nephropathy, the kidney damage, you can progress to end-stage kidney disease, which is the final stage that actually requires dialysis. At the same time, not only will you be requiring dialysis, but there will also be an issue of correcting low blood, what we commonly call anemia, that comes as a result of advanced kidney disease, issues to do with your calcium in your bones. All these things will need to be addressed and managed. Not only that, when it comes to neuropathy, we talk of ulcers, amputations, and we don't want all these things. So these complications can happen in unison, they can come together. You can have one of them, you can have a lot of them. But when they do come, they need to be addressed, they need to be treated early so that you slow advancement, because there are therapies for your nephropathy, for your kidney issues. There are many drugs. I mentioned the ACE inhibitors. There are other new drugs like dapagliflozin and its related class of drugs that actually slow progression of kidney disease. There are many other drugs that can actually be used there. And we talked of the lifestyle changes, the cornerstone of diabetes treatment: stopping smoking, balanced diet, avoiding sugar foods, exercising, stopping alcohol or minimizing alcohol, controlling your regular exercise. All these things can actually help reduce these microvascular complications of diabetes. Thank you so much for listening. For those that have diabetes, please take note of these complications. Get checked from your doctor about these complications every year, at least every 6 months. Just get a regular check. Go to